everyone, welcome to MGK Educare. So in this class, we will discuss about Norcet Pyq with rationale. So let's see the first question. Which artery is commonly used to measure blood pressure? Option A, radial artery, B, brachial artery, C, carotid artery, D, femoral artery. And the correct answer is option number B, brachial artery. Brachial artery is located where? In the upper arm, right? So it is used to measure, this artery is commonly used to measure blood pressure. Rationale, the brachial artery is used for measuring blood pressure using what? Sphygmomanometer. The BP instrument is called sphygmomanometer. Next, normal respiratory rate for an adult is option A, 10 to 12 per minute, B, 12 to 20 per minute, C, 20 to 30 per minute, D, 8 to 10 per minute. And the correct answer is option number B, 12 to 20 per minute. Clear? Next, which position is best for a patient in shock? Option number A, Fowler's position, B, supine position, C, Trendelenburg position, D, prone position. And the correct answer is option number C, Trendelenburg position. Trendelenburg position is best for a patient in shock. So how this Trendelenburg position is given? The patient is placed on their back on supine and the bed or table is tilted so that the patient's head is lower than the feet. Patient's head lower than the feet. This Trendelenburg position will increase the venous return to the heart and it improves perfusion during shock. That's why this Trendelenburg position is given during shock. Next question. Which vitamin is essential for blood clotting? Option A, vitamin A, option B, vitamin D, C, vitamin K, D, vitamin C. And the correct answer is option number C, vitamin K. Vitamin K helps blood clotting. Next, how does vitamin K helps in blood clotting? Because vitamin K helps synthesize prothrombin and other clotting factors in the liver. That's how vitamin K helps in blood clotting. Next question. The universal recipient blood group is option number A, O positive, B, O negative, C, AB positive, D, A positive. And the correct answer is option number C, AB positive is known as the universal recipient blood group. Why? Because it has both antigen A and antigen B and also the Rh factor. So because of this, every positive blood group can receive blood from any group. And please comment down on the comment section the universal donor blood group. Which blood group is known as universal donor? So individuals with every positive blood group can receive blood from any group as they have both A and B antigens, right? And Rh factor. So that's why they can receive blood from any group. Next, which hormone regulates sodium and potassium balance? Option number A, insulin, B, aldosterone, C, cortisol, D, adrenaline. And the correct answer is option number B, aldosterone. Aldosterone promotes sodium retention and potassium excretion by the kidneys. Next, what is the normal range of serum sodium? Option A, 125 to 135 milliequivalent per liter. Option B, 135 to 145 milliequivalent per liter. Option C, 145 to 155 milliequivalent per liter. Option D, 120 to 130 milliequivalent per liter. And the correct answer is option number B, 135 to 145 milliequivalent per liter is the normal range of serum sodium level. Next, which is the antidote for heparin? Option A, atropine. B, protophene sulfate. C, vitamin K. D, calcium gluconate. And the correct answer is option number B, protamine sulfate, because it neutralizes the effect of heparin. And vitamin K, it is the antidote of warfarin. Clear? Protamine sulfate neutralizes the anticoagulant effect of heparin. And it is the antidote of what? Heparin. Next, the first heart sound is produced by A, closure of semilunar valves. B, opening of AV valves. C, closure of AV valves. D, atrial contraction. So the first heart sound is produced by what? Which will be the correct answer? The correct answer will be option number C, closure of atrioventricular valves. We have two atrioventricular valves, mitral valve or bicuspid valve and tricuspid valve, right? So S1 sound is produced due to the closure of AV valves. And S2 sound is produced by what? Due to the closure of semilunar valves. So semilunar valves we have two, that is pulmonary valve and the aortic valve. Clear? Next, the main site of gas exchange in the lung is option A, bronchi. B, bronchioles. C, alveoli. And D, pleura. So, and the correct answer is option number C. Alveoli is the main site of gas exchange in the lungs. Alveoli are tiny air sacs where oxygen and carbon dioxide are exchanged. Clear? Next, which injection route has the fastest absorption? Option A, intradermal. B, subcutaneous. C, intramuscular. D, intravenous. And the correct answer is option number D, intravenous, because it delivers medicine directly into the bloodstream, so it has the fastest absorption. Next, which is the normal range for fasting blood glucose? Option A, 60 to 80 mg per dl. Option B, 70 to 110 mg per dl. Option C, 90 to 120 mg per dl. Option D, 110 to 140 mg per dl. So we know that the normal fasting blood sugar level is 70 to 110. It is normal. And pre-diabetes and diabetes. So if the value is 100 to 125, then we call it as a pre-diabetes. And if the value is more than 125, then it is considered as diabetes. Okay, so here the correct answer is 70 to 110 mg per dl. Clear? Next, which type of immunity is provided by vaccine? A, natural active. B, artificial active. C, natural passive. D, artificial passive. So what is this natural active immunity or vaccination means. This natural active immunity, it means antibodies made after exposure to an infection. Right, for example, like got an infection from a chickenpox and all chickenpox, right? So the antibodies produced after the exposure to an infection is called what? Natural active. And artificial active immunity means antibodies made after getting a vaccination. Antibodies made after getting vaccine is called what? Artificial active. And option number C, natural passive. Natural passive immunity means antibodies transmitted from mother to a baby. Antibody transmitted from mother to a baby. Antibody transmitted from mother to baby. For example, like during breast milk and during transplacental, this IgG, immunoglobulin and all. Right, IgA, IgG, immunoglobulin. Next, option number D, artificial passive. Artificial passive immunity means antibodies acquired from an immune serum medicine. Antibodies acquired from an immune serum medicine. Example, like gamma globulin and all. Clear? So the correct answer here is option number B. Antibodies produced or made after getting a vaccination. Okay, that is called artificial active. Next, which nerve is responsible for vision? A, optic nerve, B, olfactory nerve, C, facial nerve, D, trigeminal nerve. And the correct answer is option number A, optic nerve. This cranial nerve number 2, which is responsible for vision. The optic nerve, cranial nerve 2, transmits visual information from retina to the brain. Clear? Next, which electrolyte imbalance causes muscle weakness and cardiac arrhythmia? A, hypernatremia, B, hypokalemia, C, hypercalcemia, D, hypocalcemia. And the correct answer is option number B, hypokalemia. Hypokalemia causes muscle weakness and cardiac arrhythmia, means abnormal heart rate. So low potassium levels, hypokalemia means low potassium level. It can cause muscle weakness and life-threatening cardiac arrhythmias. Clear? Next, what is the best site for intramuscular injection in infants? Option A, deltoid, B, vastus lateralis, C, gluteus maximus, D, rectus femoris. And the correct answer is option number B, vastus lateralis. This is frequently asked question in Norcet exam, so note down. So vastus lateralis is the safest site for intramuscular injection in infants. Why? Due to less risk for nerve injury. Nerve injury, this vastus lateralis site is safest for intramuscular injections in the infants. Next, which condition is caused by deficiency of insulin? A, hypertension, B, diabetes mellitus, C, anemia, D, obesity. And the correct answer is option number B, diabetes. Due to less insulin or deficiency of insulin, which condition is caused? So diabetes mellitus. Hypertension means high blood pressure. Anemia means low hemoglobin level, right? Obesity means overweight. Next, which precaution prevents infection spread in hospital? A. Universal precautions. B. Personal protection. C. Isolation. D. Disinfection. And the correct answer is option number A. Universal precautions. Universal precaution means what? Treating all the fluids, body fluids, as an infectious. Right? So, universal precaution means what? I already explained. Involves treating all body fluids as infectious to prevent the spread of disease. Next, what is the normal pH of human blood? A. 6.8 to 7. Option B. 7 to 7.2. Option C. 7.35 to 7.45. Option D. 7.5 to 7.8. And the correct answer is option number C. 7.35 to 7.45 is a normal pH range. And the value less than 7.35 will be acidic, and more than 7.45 alkaline or basic. Clear? Next question. Which cranial nerve controls hearing and balance? A. Facial. B. Glossopharyngeal. C. Vestibulocochlear. D. Vagus. And the correct answer is option number C. Vestibulocochlear. It is the cranial nerve number 8. Clear? The vestibulocochlear nerve, cranial number 8, is responsible for hearing and balance. Next, which type of isolation is used for tuberculosis patient? A. Contact precaution. B. Airborne isolation. C. Droplet isolation. D. Protective isolation. And the correct answer is option number B. Airborne isolation. Airborne isolation prevents spread of TB bacteria through air using N95 masks and ventilation control. Next, which organ produces erythropoietin? A. Liver. B. Pancreas. C. Kidney. D. Spleen. And the correct answer is option number C. Kidney. Kidney produces erythropoietin, and erythropoietin, it stimulates the production of RBC, red blood cells, in the bone marrow. Clear? Next, which is the most accurate site for core body temperature? A. Oral. B. Axillary. C. Rectal. D. Tympanic. And the correct answer is option number C. Rectal. Rectal is the most accurate site for core body temperature measurement. Next, which is the normal adult pulse rate? Option A. 50 to 60 beats per minute. B. 60 to 100 beats per minute. C. 100 to 120 beats per minute. D. 40 to 80 beats per minute. And the correct answer is option number B. 60 to 100 beats per minute. Less than 60 known as bradycardia, more than 100 known as tachycardia. Clear? Next, what is the main function of hemoglobin? A. Transport of oxygen. B. Clotting factor or blood clotting. Option C. Defense. Option number D. Enzyme reaction. And the correct answer is A. Transport of oxygen. Hemoglobin binds oxygen in the lungs and releases it to the tissues. Clear? Next, which vaccine is given at birth? Option A. DPT. B. OPV. C. BCG. D. MMR. So, at birth we give 3 vaccines, right? OPV also we give, BCG also we give, and also hepatitis B. Okay. Not only BCG, we also give OPV 0, Hep B 0, and BCG 0 at birth. Next, which electrolyte is mainly found in intracellular fluid? Option A. Sodium. B. Potassium. C. Chloride. D. Calcium. And the correct answer is option number B. Potassium. Potassium phosphate and all are what? This is phosphate P. Phosphate and all are what? Intracellular electrolyte, right? Electrolyte in the intracellular fluid. And in extracellular fluid, what we can see? Sodium, chloride. Okay. Potassium is the major cation in intracellular fluid, and sodium is the major cation in extracellular fluid. Next, what is the normal range of urine output per day in adults? Option A 500 to 1000 ml, option B 1000 to 1500 ml, option C 1500 to 2000 ml, option D 2000 to 3000 ml, and the correct answer is option number C. 1500 to 2000 ml is the normal urine output per day in adults. Next, what is the first step in the nursing process? A. Planning, B. Assessment, C. Implementation, D. Evaluation. And the correct answer is option number B. Assessment. Assessment is the first step in the nursing process. First assessment, second planning, third first assessment, second diagnosis, third planning, fourth implementation, and fifth what? Evaluation, right? First assessment, second diagnosis, third planning, fourth implementation, then fifth what? Evaluation. So assessment is the first step of nursing process. Next, which lobe of the brain controls speech? Option A frontal lobe, B parietal lobe, C temporal lobe, D occipital lobe, and the correct answer is A frontal lobe. Frontal lobe of brain controls what? Speech. It is known as the Broca's area. The Broca's area in the frontal lobe is responsible for speech production. So thank you everyone. I hope everyone has understood. So this class is very important for upcoming Norcet exam. So if you like my class, please subscribe my channel for more videos. Thank you.